The gentlelady from California for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. And I want to thank you, Mr. Chairman, and the Ranking Member Waxman, Chairman Pitts, and Ranking Member Pallone for holding this important markup on the HOPE Act today. Some of us remember the fear and worry that surrounded AIDS in the 1980s. I was working as a nurse in California at the time. We called it Legionnaire's disease. At first, no one even knew what caused AIDS, and the diagnosis was considered and was actually true as a swift death sentence. However, in the last few decades, medical technology and research has transformed HIV/AIDS care and treatment, and now, thanks to these breakthroughs, HIV is a chronic condition. This has led to improved life expectancies, something to celebrate. But it also means that individuals with HIV are more likely to encounter other medical complications as they age, just like any other person. And they face unique complications as the powerful drugs that keep their HIV at bay often take a very hard toll on their bodies. These combination of factors put HIV-positive individuals at a higher risk for ailments like kidney and liver disease, and it places them at a high risk to need an organ transplant. And that's what we're trying to address here. HIV-positive individuals can now safely receive transplants. They wait on the same long waiting list as all Americans, but there might be a better way. According to transplant experts, each year we toss out hundreds of HIV-positive organs that could otherwise be viable for transplantation. Studies in other countries have suggested that these organs could be used to help people who are already HIV positive. These organs have the potential to save lives and lessen the transplant waiting list for all Americans. But instead, they go wasted because we cannot even do the research to see if they could be used by those already infected based on this outdated ban. That's why we need to pass the HOPE Act today. The HOPE Act would create a pathway, grounded, of course, in medical science, to research the feasibility and safety of positive to positive organ transplantation. Just think about it. This is a chance to possibly shorten the waiting list for all people waiting for an organ. It also is a possibility to better outcomes for those in need, and it can significantly lower healthcare costs, all while maintaining the safety and integrity of our current organ transplantation system. I want to thank and acknowledge Senators Boxer and Coburn for championing the issue in the Senate. With their leadership, the HOPE Act passed by unanimous consent in June. I'd like to thank my medical colleagues, especially Dr. Harris, the bill's Republican lead, and Dr. Burgess for their support. And finally, I'd like to thank all the advocates who've come together around this bill. The HOPE Act benefits from a very broad and hardworking coalition of supporters. I want to acknowledge one advocate in particular, who's Mr. Thomas Lane, an HIV positive and a double kidney transplant recipient. Tom was incredibly brave to share his story publicly at a briefing last year on this topic. Unfortunately, he recently passed away from chemo complications, but I know he would be heartened by the HOPE Act's momentum. The HOPE Act is a common-sense bill that creates a path forward for research on this issue. As I've said, it's supported by a broad coalition of supporters from the medical, the research, and the HIV patient populations. It has strong support on both sides of the Capitol, on both sides of the aisle. It's a critically important issue, an opportunity to save lives. That's why I'm urging a yes vote on it today, and I'm prepared to yield back. But I also want to include, and I'm going to list these because they're significant, Mr. Chairman, letters of support that I would like to enter into the record from the following organizations: the American Medical Association, the American Society of Transplant Surgeons, American Society of Transplantation, United Network for Organ Sharing, the Dialysis Patient Citizens, the American Society for Nephrology, the American Civil Liberties Union, the HIV Medicine Association, and a joint group letter of support featuring many other organizations, including the Association of Organ Procurement Organization and the Organization for Transplant Professionals. With that, I yield back my time.